might be fuddling when someone or a loved one is experiencing aberrations in their mental functioning, because many people may not understand what is going on. And when they realize it might be a mental disorder, they get even more disconcerted and afraid. They start thinking of what to do, who to tell, where to get help, and what might happen to them on the long run. Unfortunately, most people look for help in the wrong places because of many reasons, chief of which is stigma. In the event of a mental disorder, doing the right thing at the right time saves one from a lot of complications and further distress. Instituting the right treatment at the right time is important so that the person is able to function at the maximum potential as soon as possible and live a productive and fulfilling life. Most times, many people seek advice from relatives, close friends, clerics, and the internet. However, sometimes these people may give the wrong advice, genuinely out of ignorance. In Nigeria, mental health literacy is quite low. One might also get the wrong information from the internet because not all internet information is correct. The internet is a potpourri of truth and falsehood. Anybody can put any information there, and people just believe this information without checking whether the person is qualified to speak or write about the matter in question. So, what is the right thing to do? Whenever there is a health challenge of any kind, be it mental or physical, the first step is to see a qualified medical doctor. The human body is highly sophisticated and complex. It is not to be toyed with. This personnel, that is the medical doctor, has been trained to decipher health problems. Even if the doctor is not a specialist in the matter at hand, he or she will refer you to the right specialist because that is the right and ethical thing to do. Unfortunately, many people do not go to the doctor first. They jump the gun, sometimes even patronizing quacks who claim they are experts in such matters. Healthcare, whether physical healthcare or mental healthcare, is a teamwork. More than one professional may be involved, but it is also very structured and methodical. Every health evaluation and intervention begins with the doctor, who identifies and defines the scope of the problem at hand. This is a universal basic protocol in healthcare delivery. It is commonsensical to identify and understand the problem first before preferring the appropriate solution. Many symptoms of ill health are not specific and could signify problems in different organs and systems in the body. For example, fever is a very common health symptom here in Nigeria. The commonest cause of fever in our environment is malaria. But even at that, the proper thing to do is to go to your doctor for evaluation. Because fever is a non-specific symptom, meaning that there are so many illnesses that can manifest as fever. Most times, people get away with self or quack-made diagnosis when it is truly malaria, but oftentimes too, it may not be malaria. When people have fever, sometimes they just go to the pharmacy to buy drugs without confirming with their doctor what they suspect. Sometimes it backfires when it is not what they think. So what I'm saying is that there may be symptom overlap. A symptom may look like that of a particular disorder, yet it may also be indicative of many other different illnesses because the human body is highly intertwined and integrated. The same thing applies to mental disorders. Many psychological symptoms may be non-specific. That is, different mental disorders may manifest with similar symptoms. For example, persistent poor sleep is a common symptom of so many disorders. Some people believe someone not sleeping well is likely depressed and probably brooding over their problems. It may not be so. It may not be depression. It is imperative to have a proper assessment and evaluation by the medical doctor to determine why the person is not sleeping well. Another example is a child who is not talking as expected. Poor speech development can be a symptom of many mental disorders. Yet, some people just make diagnoses themselves using checklists downloaded from the internet or get the diagnosis from unqualified persons. Checklists can never replace comprehensive clinical evaluation. Sometimes, a lot of parents go straight to the therapist or to so-called therapy centers without first seeing the medical doctor. The therapist ideally should not start therapy without first knowing what the doctor has assessed the problem to be, because therapies are tailored to the underlying problems. For example, speech therapy techniques used for a child with intellectual disability is different from that for a child with just a developmental delay. Some of these therapists even make diagnoses. This is very wrong because they have not been trained to do this. This is pure and straightforward quackery. Qualified professional therapists, whether behavioral or speech or occupational therapists who know their onions, will not do what they have not been trained to do. Another example is when a child is restless. There are many different possibilities. It may not be ADHD, that is attention deficit hyperactivity disorder, like many people will think. Many non-doctors do not know that there are different subtypes of ADHD. These subtypes are very technical to decipher, and only the right professionals can determine it. Many think a child with ADHD must be very restless, hyperactive, and all over the place. When a child has the inattentive type of ADHD, the child may indeed become and never hyperactive. So, if a child has been diagnosed by a quack as having, let's say, autism, and a comorbid ADHD, the inattentive type, was missed, no matter the amount of therapy done, the child will not improve significantly until the undiagnosed comorbidity is attended to. When a child has abnormal gestures, or cannot talk, or cannot play as expected, it is not always autism. The best person qualified to diagnose correctly any mental disorder in the human being, whether adult or child, is a psychiatrist. Some people prefer to see a psychologist instead of a psychiatrist because they feel that seeing a psychiatrist means madness. Psychologists are trained in psychological matters, but there are organic matters that can present as psychological symptoms. That is, problems in other parts of the body, apart from the brain, can present as psychological symptoms. Only a medical doctor can diagnose this. A good example is depression. Many people think depressive symptoms are caused by only psychological disorders. Depressive symptoms can be seen in some other bodily problems like endocrine disorders, deficiency states, malignancy, cerebrovascular diseases, and many more. So, imagine a so-called therapist diagnosing and managing depression when in fact this depression is caused by an underlying malignancy. What can be more disastrous than this? The summary is that when you or your loved one experience symptoms probably indicative of a mental illness, see a psychiatrist. It doesn't mean you are mad. There is a broad range of mental illness. There are many other mental illnesses that may not present with weird symptoms, but still cause serious mental distress and suboptimal functioning. This is the 21st century. Do away with archaic beliefs that mental disorders are shameful or a sign of weakness. Your psychiatrist will diagnose you correctly, outline and institute the appropriate intervention, and make referrals to other mental health professionals like the clinical psychologist, occupational therapist, speech therapist, and so on, as needed. Medicine is a highly specialized discipline. deeply technical and nuanced, with many subspecialties that handle specific areas of human health and illness. Even when you don't know where to go, start with your family doctor. He or she will guide you appropriately. Also, as a health service consumer, ask questions, especially in a country like Nigeria, where we are title conscious and so many people want to have the doctor title. You need to be careful and perspicacious. Having a PhD or honorary doctor title or self-imposed doctor title does not mean that person is a medical doctor. So find out which is which. Do not be afraid to verify. After all, you are paying for the services. Even when it is free, it is still your right to know. Do not take chances with your health or that of your loved one. Thank you.